How y'all doing today? It's your boy Jermaine from Eat Right Guys Nutrition and Fitness, back with another video. Shout out to Jacqueline. She's an up-and-coming dietitian of the future. She also has a YouTube channel that I'll leave in the bottom of the description. She wanted me to talk about the standards and practices of dietetics. So basically the nutrition care process. And what I'm gonna do is I'm gonna explain it at first, and then since I've worked in 3 different areas of dietetics, one being clinical, renal, and then general outpatient, which I'm doing now, I'll just go through the differences in the standards of care and how I assess patients depending on like where I work. And in general, it's basically the same thing, but depending on what company you work for, as well as what type of patient you're seeing, it may be a little different. So before we get things started, let me just talk about the nutrition care process. So the nutrition care process is 4 different parts. You have the nutritional assessment, which is the first one. You have nutrition diagnosis, then you have nutrition intervention, and then you have nutrition monitoring and evaluation. So the first section, nutrition assessment, is basically where you gather all the objective and information from the patient, as well as the things that the patients are saying that may not be 100% accurate. So one, it can be like their height, their weight, their body mass index, their ideal body weight, their percent ideal body weight, if they lost weight in the past, if they've gained weight. You can also look at their lab values. You can also do a food frequency questionnaire to see what types of food that they eat and how often they eat them, or you can do like a 24-hour food recall to see what they kind of eat on a regular basis. Or you can just ask them, what are some of the foods that you eat on a regular basis? Just give me like a whole day's worth of eating, starting from breakfast all the way to dinner, including snacks. And so this is going to give you like a general picture of the patient. You can also throw in if the patient may be malnourished, doing a physical malnutrition assessment on the patient, where you kind of evaluate them for potential muscle or fat loss. So like I say, nutrition assessment, this is the first thing you're going to do. This is just to gather information about the patient to see exactly why the patient is at nutritional risk and why are you seeing this patient. And then this leads to nutrition diagnosis. So after you gathered all the information, you want to make a nutritional diagnosis. So this is pretty much going to be used to determine how you're going to intervene with the patient. Also, what are some of the things that you're going to monitor and evaluate on different follow-ups. So let's say the patient is diabetic. You did your assessment, you found out the patient's hemoglobin A1C is elevated, their fasting blood sugar level is elevated, then their diagnosis may be, diabetes. And upcoming, I'm gonna show you how we actually write these diagnoses. So that's the diagnosis. Then you have number 3, which is the nutrition intervention. So based off that diagnosis that you came up with, now you're gonna figure out, okay, how am I gonna intervene with this patient to kind of correct this problem? So whether it be educating this patient, also this is where you can write your nutritional recommendations, whether in terms of like how many calories they need a day, how much protein, if they're diabetic, how many carbs they should eat within a meal, what types of carbs. So this is right here is where you're gonna intervene with the patient based off the nutrition diagnosis. And then the last step is gonna be nutrition evaluation and monitoring and evaluation. These is where you and the patient can set goals that you're gonna use for the upcoming follow-ups. You can also detail how often you want to follow them up. If they're really critical, you may want to see them the next day, maybe in 2 days, maybe in 3 days, or maybe you want to see them once a month, once every 3 months. But it all depends on where you work, how critical the patient is, and what exactly the problem is with the patient. So those are the 4 steps of the nutrition care process. So let's break it down again even further based on the 3 areas that I've worked at, and I'll give you examples. So In terms of nutritional assessment, let's go the clinical route. If you're working in a hospital, let's say that you have a patient that is a tube feeder. So you're gonna do your basic assessment, height and weight, BMI, check their chewing and swallowing ability, check to see if they have any GI issues, nausea, vomiting. You're gonna check their labs, you're gonna read other people's notes, whether it's the nurse's notes, the doctor's notes, speech therapy note. Let's say the speech therapist said that they failed a swallow study, they're aspirating, they need a PEG tube placement, they can't swallow by mouth. Also, you've realized you did a 24-hour food recall and you've seen that they're not eating an adequate oral intake because they can't swallow. So that's the assessment for a clinical standpoint of somebody that's a tube feeder. Now let's go into renal and assessments. So renal is going to be the same way: height, weight, if they can chew and swallow, also their labs. But also in renal, you may have to see, okay, what type of access do they have? Are they using a fistula? Are they using a graft? Do they have a vascular catheter? What type of dialysis are they using? Are they on PD or peritoneal dialysis? Are they on hemodialysis? What is their schedule? Are they coming 3 days a week for 4 hours? Or are they missing some days? What are their lab values? Do they have elevated potassium levels, elevated phosphorus? Their PTH, so are they on vitamin D? Is it calcitriol? Is it hectorol? Are they on a calcimimetic like Sensipar, or are they taking phosphorus binders? What type of binder? How many of the binders are they taking? Are they taking them properly? So those are some of the things that you can assess from a dialysis or a renal standpoint. In terms of outpatient, general outpatient is going to be pretty much the same as clinical. The one difference is you're probably not going to do like a malnutrition physical assessment, because in my opinion, it's not really appropriate. In a clinical setting, it's a lot easier because the patients are in gowns, so it's a lot easier to see their full body and to assess them. Usually in outpatient, they're in regular clothes, and they may not need to do a physical assessment because a lot of times they're not that critical. So that's the assessment part from those three categories. Now let's get down to nutrition diagnosis. So this is when you pretty much make a nutrition diagnosis based on the things that you found. So let's go back to the clinical. And oh, I forgot to mention, in nutrition diagnosis, you use PES statements to write the diagnosis. So the P is going to stand for the problem. So what is the problem that the patient has? Then you have E, which is the etiology. So what is this problem related to? And then you have the last part, which is S, which is signs and symptoms. And this is the objective findings. So you have the problem, what is the problem related to, and how and what objectively did you find to validate this problem? So let's go and use the tube feeder from the clinical aspect of it. So one of your problems could be inadequate oral intake. And so that's your problem. So, and then your E, your etiology, what is that related to? That could be related to the patient may have had a stroke. So inadequate oral intake related to complications following a stroke. And then your signs and symptoms would be like, objectively, how can you tell that this patient has inadequate oral intake? And so your signs and symptoms could be after doing like a 24-hour food recall, the patient is consuming 500 calories. Or you can document the patient has unintentionally lost 10 pounds in the last week or something like that. So that's an example of writing a PS statement for that. You can also do, for that example, the problem could be difficulty swallowing related to complications from a stroke as evidenced by a failed swallow study by the speech therapist and the placement of a PEG tube. So that's an example off the top of my head. So now let's get into renal. So with renal, let's say that you did your assessment and you find that your patient has hypercalcemia and are also taking a calcium-based binder. So your problem would be hypercalcemia, which is elevated serum calcium levels related to the intake of a calcium-based binder, and then your signs and symptoms would be as evidenced by a serum calcium level of 10.5. So that's an example right there. And so now my third example would be from like the outpatient, general outpatient. And I usually see like a lot of diabetics as well as a lot of obesity. So let's use obesity. So your problem could be excessive energy intake related to, so they're obese, related to, let's say you talk to the patient, you assess the patient, and you did a 24-hour recall, and you found that this patient is eating a lot of high-calorie processed foods, and they don't know that these foods are high in calories or processed. So your etiology could be food and nutrition knowledge deficit of foods that are high in calories, as evidenced by, which is your objective finding, as evidenced by a BMI of 40. So that's an example of a nutrition diagnosis from somebody obese. All right, so now we can go to interventions, in which now that we have the diagnosis, we know what the problem is, how are we gonna address it? So in terms of clinical, when we come in our tube feeder, this is when you wanna put your recommendations, your tube feeding recommendations, your calorie recommendations, your protein recommendations. Also, like your rate, how many milliliters an hour you want to feed the patient this formula, as well as selecting the actual formula. Then you also want to do water needs, so if they need water flushes, things like that. Maybe you want to educate the patient on the tube feeding so they can know what's going on, educate their family. So that could be like an intervention. In terms of dialysis, one of your interventions could be educating the patient on hypercalcemia, maybe switching them to another binder. Maybe you need to make adjustments in vitamin D. So those are the things that you can do to correct that problem of hypercalcemia. In terms of the obese patient, maybe some of the interventions could be educating them on foods that are lower in calories, teaching them about eating more fruits, vegetables, whole grains, nuts and seeds and legumes, things like that. Setting your goals, setting their calorie needs to help induce weight loss. And so that would be your interventions. And so last but not least, we can talk about your monitoring and your evaluation. So in terms of the tube feeder, one of the things you can monitor is actually how much of the tube feeding they're getting. Also, you can set a goal within 2 days. I want the patient to receive 100% of their calories via tube feeding, monitoring how much they're getting from the tube feeding pump, also monitoring their labs, different things, monitoring their weight to make sure that they're gaining weight properly. And then you can set maybe a 2-day follow-up, a 3-day follow-up. Usually in clinical, the follow-ups are pretty quick because they're more at risk, they're more of an at-risk patient. In terms of renal, with hypercalcemia, one of the things you're gonna monitor is their calcium levels. So maybe you're gonna do another calcium lab the next week. You can monitor if they got their new binder in, if they're taking their binder. You can monitor, are they still taking a calcium-based binder, different things like that. You can set their reassessment to maybe like 3 months. And then with renal, like I say, it kind of depends on where you work at. So like in renal, instead of seeing the patient in 2 days or 3 days, you can still monitor their labs, but you might not do a reassessment until like the next month or in 3 months, depending on if it's a comprehensive assessment or just a regular nutrition note. And then the third case with the patient that is obese, you can set goals. In the next month, I want the patient to lose 2 pounds. You can also monitor, next time you see them, do another 24-hour food recall to see what type of changes they made. And then you can do like the reassessment in 1 month. And so to where you can kind of monitor them and reevaluate them. And then if they still have that same problem, you can just start the whole process over again with another intervention, or you can re-educate them and then you continue to monitor. So hopefully this video made sense. It's kind of all over the place, just went off the top of my head. So that's basically my experiences with the nutrition care process and how they can be used in dietetics. And like I say, it's mostly the same for the most part in all different aspects of dietetics, but there are slight differences depending on where you work, what are the items that you have to chart in the medical record, and what area of dietetics you're working in. And I'll see y'all next time. Peace out. And if you're a nutrition student or a dietetic intern and you're concerned about passing the RD exam, feel free to join my Facebook group, RD Exam Prep, which will be down in the description. And this is where you can be part of a community that will answer any questions that you may have, as well as I provided free study guides, notes, and practice exams. And while you're at it, follow me on Instagram at Eat Right Guy, and visit my website, eatrightguide.com, where I post weekly blogs on nutrition and dietetics related topics.